Good morning, and I think we've dealt with two very important topics this morning, and we have a very packed schedule. I just wanted to lighten up the talk, the presentation a little bit, and I want to start with asking you a question rather than me just doing a presentation. And so my question to you is, how many of you have heard or experienced implementing digital health programs in your country? Just raise your hand if you have. Yes? That's all? Okay. And how many of you use any form of digital platforms, dating apps? Come on, no judgments. Damn Vic. I'm sure everybody has access to Facebook, Twitter, LinkedIn. Okay, it's not that all bad, right? LinkedIn and Twitter is not. Okay, so how many of you have more than one account on Facebook? Yes? Come on, be honest. Okay, how many of you have tried using platforms like LinkedIn or Twitter to find partners?
Oh, sorry.
What do you use it for?
Okay. Did you know that LinkedIn and Twitter can be used to find partners? Or is it just more of like an information sharing platform? Right? Okay, so there are various things that have been tried, that have been implemented in various different countries for different reasons. And I think all of that forms what we know as digital health, or what we know as virtual interventions. So there's a very it's a broad terminology which would include various different things like telehealth. It would include finding clients, finding partners online, booking appointments, online consultations with a doctor. All of this would be included as part of digital health. Okay, so if you are implementing any of these are all considered as digital health tools, platforms, or virtual interventions. So, it's not moving. They don't want me to do this presentation.
Digital.
Digital. That's right. That's so right. Oh. I clearly am not digital. Okay. Okay. So just to give you all a little bit of a background, what really drove us to be digital, or in terms of health programs I'm talking about. So when, a few years back when we were implementing HIV programs in our countries, in regions, we identified that we have reached a point of stagnation. We were not able to find new people. We were not able to help people get into services for various reasons, stigma, discrimination, various things that we've heard of. And that's when we actually started exploring the online world. And we identified that, whatever population we used to find in the physical spaces are now actually available online. So using different kinds of platforms, dating apps, etc. And that's when we thought that we also need to move online on these virtual spaces to ensure that we are reaching the right population and we are able to bring them to services. And so we started reaching out to this population through various outreach programs, through influencers, and any advertisements that you would have seen as well. What we saw is that this population online, or the youth or the younger generation, does not want to identify themselves as key populations as we know them. The four broad categories of key populations. They do not want to bucket themselves into just those four categories. And why should we? We should allow them to be as free as what they want to identify themselves with. And I think that was the problem that we were facing a few years ago when we wanted to bucket populations in these four categories. And we were missing out on a lot of population, because there was a lot of population that did not identify themselves as key populations and therefore were missed out of programs. And so then came COVID, as we know, and countries were struggling with continuing to provide services to populations, and that's when virtual interventions actually got a lot of boost. We saw that countries were adapting digital means of connecting with people, bringing them to services, providing services to them, all of that started happening in the digital world. And we also saw that apart from being good at doing that, we saw that there was a lack of structure. We saw that countries were implementing virtual interventions in an ad hoc manner. There was no reporting structure to virtual interventions. Even today, if I ask any program or country how do they report people that they find online, most programs or countries will not have a robust reporting structure for virtual interventions. So these were some things that we were seeing as part of our program. Now, being a part of the HIV sector, I'm sure you all know this, I don't need to go into more detail, but there were very, very prevalent gaps that we were seeing in the program and why we were not able to reach out to populations. And some of them are listed here, not all. And like I mentioned, non-identifying populations, they do not consider them to be in risk, or stigma discrimination, of course, is still a big elephant in the room, and lack of options for accessing services. So when you expect somebody to just come to a facility and access services, that is not working for everybody. We cannot fit everybody in the same structure. We need to have differentiated service delivery for every single person that wants to access service. And so then the question comes, why did we go virtual? Why should we go virtual? So let's look at some statistics to triangulate what I was talking about in the previous slides. So we've seen that a lot of population, about 5.56 billion people, actually use internet as per today's population statistics. We've seen that out of those that use internet, 5.24 billion people also use social media. So when I say social media, this includes your Facebook, Twitter, TikTok, dating apps, everything. About 6.5 hours is being spent on the internet, doing everything that can include finding information, to chatting, to whatever you do on the internet. And when we talk of social media usage, we see that a very large number of population in Asia uses internet and social media. So 61% in Southeast Asia, 33% in Southern Asia, and about 76% in Eastern Asia. We've also seen that digital technology has given way for people to actually find information on healthcare online. So how many of you actually Google when you have an issue? You Google to see what it could be, or you Google to find a facility near you? How many of you do that? We do that very often, right? So people have started moving towards those digital means that are now available to even find very, very basic things that you previously used to rely on facilities and physical modes when it comes to healthcare. And we've seen that 122 million people have actually at some point used a doctor consultation online, and this is a one year data. So you know that a lot of people are looking at these kind of methods to be reached and to access services. 1.3 billion people have used digital means or platforms for treatment and care, and we've also seen a large number of population that has been checking symptoms online to understand what's happening to them. So when we talk of digital technology and with respect to healthcare, there are a few buckets that we've identified which formulate the digital health scenario. So telemedicine is definitely one, which is like you consult a doctor online, you get your medicines prescribed, and then it can be delivered to your home. Electronic health records, so basically transformation of paper records to digital records. You would have seen a lot of platforms are now available. There's DHIS 2, there's Power BI if you've heard. There are various new AI-based, non-AI-based platforms that are now available which can help you do that very, very effectively. Mobile health, booking appointments, getting to a place, getting any access to service, booking a self-test kit online and getting it delivered to your home. This is all a part of digital technology, mobile health. Patient monitoring, this has really helped healthcare providers to monitor patients' journey when they are due for another test, when they are due for treatment, when they are due for a refill of ART, for example. And then of course, the new kid on the block is artificial intelligence, which also is a part of the digital health framework that is being currently used for healthcare. So this artificial intelligence is also being used in a very, very big way now, which I will talk in my further slides. So just to give you a little more information in terms of how useful and beneficial digital health can be. It is actually useful and beneficial at different levels, not just for the client but for healthcare workers as well as the organization. You can use digital health tools and technologies to help you do various things at all these levels as well. This is an example of a density mapping that was done in Mumbai a few years ago. This was done using a gay dating app called Grindr, where we logged in at particular times of the day and particular days of the week to see how many people were active at that point in time. And it's important to understand that we were able to map out areas in which there were more active users, and then this data helped outreach workers reach them with information and services. So we also did social media influencer outreach. So this is from Indonesia, an influencer called Cat Womanizer, who actually recorded a video of herself booking an appointment online and going to a clinic to get tested, fully anonymous and not having to provide any major identity related information. This is social network based testing, again just an example for you to show what can we do with digital health tools. And social network based testing is similar to what we do in the physical world, where we usually give coupons to the seed and then we move on into their unknown networks. The same thing was done using a digital health platform where we provided e-coupons or QR code based coupons to the seed and then moved into their networks. These were all very high risk unknown networks, and we found about 3.3% HIV positivity and 10.5% syphilis positivity, and this was just the data of 1 week. These are some examples of social media posts. You would have seen dime a dozen on internet, on Facebook, on all the platforms that you might be accessing. There are various kinds of information and advertisements that are available on the internet. Accuracy of these post is extremely important. So if you or your organization are posting something for information for other people, it is extremely important that they are vetted and they are accurate information, because somebody is going to read it and somebody is going to follow it as well. We did this in a country in Africa called Eswatini. This was like a self-testing campaign that we had done, and where we just posted this picture, and in a span of 2 hours we had about 500 people asking to buy a self-test kit. So it was quite a successful campaign, and these advertisements really worked to reach a large amount of population. This is another example of a very good public-private partnership, I would say, because here they've partnered with Grab, which is a food delivery app, to actually deliver commodities. So your condoms, your self-testing kit, and even PrEP can be delivered through Grab, which was really useful, I think, because it reduces stigma, because it's just a Grab delivery that's coming to your house. At the same time, it's making commodities so much more accessible than it could be when you have to go to a facility to access them. Of course, there are challenges and considerations for everyone. It's important that we make sure that our data is maintained, it's private, it's secured. There is equity, because not everybody can get access to all the technology and the digital health platform. So it's important that you plan your programs based on equity and the availability, affordability in your country context. There is a lot of data that is being used for building AI models. And currently, there's a lack basically of good data, good accurate data to build those AI models. And so it's important that there's evidence-driven data that is used, and not just any photograph or any data that can build an AI model, because that AI model will then give you wrong results or can have an impact in the way you're doing your programs. And resistance from stakeholders is something that we need to work on. Like Nitya was mentioning, advocacy is extremely important, and we need to work towards breaking this resistance. There are a lot of products that are already available on the WHO website that we've worked on. There's a virtual interventions policy brief that will give you all the details about framework, how do you implement it, what are the approaches. All of those information is available. There's also a recently launched budgeting guide that we've developed to help you budget virtual interventions in your upcoming grant cycles or grants. And there are some other recommendations on overall digital health as well as ethics and governance for using AI that is available currently. And we have a technical brief on AI for HIV, hepatitis, STI going to be launched next year. Some key recommendations, and this is for the session that we're going to have now, which is the group work. I think it's important that we understand that virtual interventions or digital health tools are not meant to replace what already exists in the physical world. We are not saying shut all of that and just go virtual. It needs to supplement whatever is happening. It's also important that we integrate digital health as part of our national program. It can't be a silo. It can't work in a vertical. It has to be integrated into the national program to be able to be scaled up and to have the kind of impact that we want to see. It is important that we understand both advantages and disadvantages of using technology and plan your program based on that. Ensure safe and responsible use of AI. Please don't fall into the trap of AI building companies where they say that we'll build this, you give us data and we'll give you this product. It's important to understand what they want to do with that data. And data security and confidentiality is a must. I think the kind of population that we deal with are already vulnerable and marginalized, and they are facing a lot of stigma discrimination. So their data has to be really kept really confidential, and we have to ensure that we're doing that well. Thank you. I'd like to thank my colleagues and partners for the slides, and any questions, open to that. Thank you.